All right. Well, welcome everyone. Thank you so much for coming to the July meeting of the HB 4086 Jurisdiction Advisory Committee meeting. I'm Leslie Ann Hay. We are recording this meeting. My partner, Sylvia DePorto, is also here. We're the co-facilitators for this meeting. And I'm going to go ahead and turn things over to Sylvia here to get us started.
All right. Well, welcome everyone. Good to see everyone on this nice midsummer day. All right, so let's just make sure everybody's doing good and thinking about summer plans. So we don't know how many folks we're going to have today because we're not sure about vacations and all that, but hopefully if you are planning a nice vacation and thinking about getting ready for that, or you came up a nice vacation, if you want to share anything about that, what you're doing for the summer, anything exciting, and even if you're not doing anything exciting, I see Annalise broke some toes, or part of her foot, so she's not going anywhere. But if you just put that in the chat. Somebody, Alexis is saying Southern Oregon's on fire. That's not good. So, but just put in the chat whatever is going to be happening in your summertime. That would be great. All right. Okay, so for today, our agenda, we're going to really talk about the report, the first half of the report, the draft report, and the validation highlights. So what we saw in the validation process and how we incorporated information into the report. And we want to talk about identifying implementation considerations as you think about preparing to read the revised first half and then the draft second half of the report. So that's going to be our focus today, is really talking about what the implementation, talking about the validation process for the first half of the report, and then the second half of the report that you'll be focusing on and also thinking about implementation considerations and the next steps for us as we get ready to finish up this this work that we've been doing together. Next slide. All right, so just a reminder of our community agreements. We want to make sure that we're bringing our curiosity, reflections, vulnerability, skills, courage, and authenticity to the work of the committee, to keep ourselves and each other focused on our mission in general and on specific points in the moment. Open ourselves to each other's perspectives, experiences, and suggestions, and stay oriented towards solutions that move us towards our goal. Seek out, engage, and respect all voices of those impacted by our mission. Those are our community agreements. So we're going to focus this first section on just really talking about the first half of the report, the draft report, the response rate, and some of the highlights of that, and the validation process. All right. So, as you recall, we sent out, after the last meeting in June, we sent out the first half draft of the report. We broke it into two halves, and we sent out as well a validation instrument that you all used. We received validation input from 13 of the joint advisory, jurisdictional advisory committee members in completing the entire form and providing feedback. So what we did with that input was we cleaned up the typos that were identified. We clarified membership information. Any phrases that seemed awkward or weren't stated correctly needed to be reworded, and some incomplete sentences. We grouped like comments by recommendation and content, and we actually probably moved some things around so that they made more sense if there was really focused on flow, I think. We addressed conditions from accept with conditions responses. So if there was an accept with condition, we really looked at that and considered that and tried to address that as much as we could in the report. And then because of some of the comments that we got in the accept with conditions, we really sought some additional information and consultation as we needed, because there was some additional information, a little bit more research that we had to do, adding some examples and stuff like that. And then we incorporated the opposed comments in the appendix. So if there was an opposed, as you may recall, it was opposed with why you oppose it and what would you suggest as an alternative if you were in opposition to the recommendation. And those comments are all included in the appendix for everybody to see at the end of the report. Any questions or comments about any of that? All right. So our responses, remember, to 13 responses for the 12 recommendations. And this is what they look like. There were some of the accept with conditions were very minor changes. As I mentioned, some of them were like defining the acronyms, adding some clarifying terms, or really like moving stuff around because it wasn't making sense. Adding supporting data to what we were talking about. Most of the accept with conditions were suggestions that would make the content would give more context to what we were saying, explaining it, giving reasons for it, or really providing more clarity around the writing and the recommendation. So we see that for bringing alternative pathways to scale, we had 4 accept as is and 9 accept with conditions. We didn't have any opposed out of the 13. Reducing the span of the third party, other 5 accept as is, 8 accept with conditions. Naming the perpetrators and statutes, 9 accept as is and 4 accept with conditions. Lifting the statutory requirement that ODHS must issue all child abuse dispositions. There were 7 accept as is and 6 accept with conditions. Allowing delegation of certain investigations, 8 accept as is, 5 accept with conditions. Account for the 418 definitions and 419B, 9 accept as is and 3 accept with conditions. Reclassifying threat of harm definition, 8 accept as is and 3 accept with definitions. With conditions, sorry. Refining the neglect definition, 9 accept as is, 4 accept with conditions. Also we had 1 oppose on the 418 definitions, and reclassifying threat of harm had 2 opposes. Adding the poverty exception to the neglect definition, 9 accept as is and 4 accept with conditions. Adding observability to mental injury definition, 8 accept as is, 1 accept with conditions, and then 3 were opposed. Removing seclusion and restraint as abuse types, 8 accept as is, 4 accept with conditions, and 1 opposed. So as you can see, I think we had a lot of accept as is, and we also had a good good amount of accept with conditions, and that's where we spent a lot of our time on really trying to look at what were those conditions and trying to include those. That was the 7 that were opposing any recommendations we made. A few had to do with implementation plans and concerns. So they weren't necessarily about the recommendation itself, but more about implementation of that process or implementation of that recommendation and concerns about the implementation. Several focus on the need for additional context to be added to explain it better because it felt like it wasn't clear. That wasn't clear. An alternative opinion about the recommendation was offered, and we've included most of that where possible and if possible. So we did add quite a bit to it. Any questions, concerns? Let me check the chat.
Didn't see anything in there, so
Nothing. Yeah. Okay. Thoughts? Okay. Now, if you didn't, we'll be talking later in a few minutes too about if you didn't have a chance to review the first draft, but you'll still have that opportunity. So we'll move on to the next slide.
Oh, Adam had his hand up.
Oh,
I think you're headed right in the direction I was going to ask a question about. So I'll take
Okay.
All right. All right. So some of the key revisions that were stimulated by the validation process, we've included in here just so you could see what were some of the major things. So we feel like these recommendations and that came out of the validation process really improve the report in a number of ways. And you can see them in the first half of the report, marked with track changes. And you'll also see included in the first half of the report is the child-on-child abuse recommendations, which weren't in the first half of the report previously. We worked on those after, and so now they're in there and you'll be able to see them. And then the narrative around what to do with that will be included. So we added some examples of alternative pathway programs from other states because that was a request that there be some examples provided. A lot of states, just so you guys know, a lot of states are still in the process of development of their alternative pathway programs. And so in terms of data that shows very successful alternative pathway programs, unless they've been running for a very long time. So specifically around the Families First Prevention Services Act, a lot of folks are using that money to really shore up their alternative pathways now. So the examples that we found, there were not a lot of examples, but we were able to provide a few. We expanded the context and added data from the Office of Training and Investigation Services digital data book to strengthen the rationale for the third-party other. We added examples for wrongful restraints and involuntary seclusion. We simplified the recommendation for consolidating the dual terminology for dispositional findings so that it's a little clearer about what we're doing. We had to do a lot of research around the actual statutes and what's in the statute and what's not in the statute and try to figure that out in order to clarify those recommendations so they look a little different than what they were before. Added more justification for unbundling and reclassifying the threat of harm into other various abuse types and classifying that in the abuse type of physical sexual abuse or neglect. We added examples from other states on how they're wording their poverty exception so that there were a variety of examples that could be drawn from. And there were a lot of poverty examples. There's quite a few, 20, maybe 27 states or something like that have examples. So we just pulled out about 5 of those. And then we strengthen the justification for the mental injury recommendation. So those are the things that were really modified, changed, revised, added as a result of the validation tool. So we really want to thank those of you who did complete the first half validation tool. We appreciate your very thoughtful comments. It's very helpful to us and really creating an opportunity for us to do some research, some digging, some reflection, and improve the information that we were providing in the report. So we really appreciate and thank you for taking the time, because we know how busy everybody is and how difficult it is to spend the time doing that. So for those who did complete the process, what we wanted to know was how that experience was for you. How was it going through that validation process? Was it easy? Was it difficult? Was it okay? And really tell us what worked well and what review process improvements might you suggest to us, because we can consider those before we get this, hopefully, if they're not too cumbersome, hopefully before we send out the second half of the report tomorrow. Thoughts, Adam?
Well, I always have thoughts. I mean, I guess I thought it went pretty smoothly. So I feel like it was pretty good. One, I have strong opinions, but they're also like easily shifted with other expertise is added. And so I wonder if it would have been beneficial for me to be able to see other commenters and like their concern if they like in real time if they had expressed reservations. I don't need it attached to a name, but just kind of because we're all touching different parts of the elephant here, right? Like there are things that I don't necessarily think about or am not an expert in. So that would have been helpful for me at least.
Mm-hmm.
I don't know that that's possible, but
Yeah, that's an interesting idea, Adam. We actually did think about that in terms of the issue with having folks have access to the the spreadsheet, that comes back from Google Forms when everybody submits their information. The thing is, everything was coming in on a flow basis, kind of, and so it would have been an after the fact sharing. And now that I'm thinking about that, it's the challenge of not only getting the report done, but sort of documenting the breadcrumb trail, right? That went from that set of inputs to then a set of changes. So now there's a new version. So I think when you look at the new version, we were going to remove the comments. We loaded the comments into the version for us to be able to respond to everything and know that we had pretty much responded to everything that we could. We were going to clean that part out and give you guys a clean version for this next round. I don't know how other folks feel. We felt like it would be a big distraction at this point to have like 87 comments on the side of the document while you're trying to read a track changed document as well. And so, I'm really curious what the others think about Adam's thoughts. If you had that same experience and kind of wished we could emulate the group process, by seeing what other people are thinking, or what other folks think about that. Here, wait, let me get Nicole in here first. There we go. Did anybody have that experience, or were you happy to just have your green eye shades on and just heads down in your own comment world and you guys can open up your mics if you want to, but Amanda, I hadn't considered it, but I do like the idea. I appreciate the perspective and expertise of others on the team. Yeah.
Mhm. Hmm.
I mean, anybody else have thoughts about this?
Lisa
Lisa,
liked the process.
like the process as it was, worked well. Okay, good. I think I see other people typing maybe. I think it would be helpful to see the comments, but I made comments. So, Annalise,
And Scott has his hand up
and
too.
okay, and then Brian's challenging. They're not good communication tool for viewing input for 14 people. Yeah. Okay. But after, okay. Yeah, that's what I was thinking too. It's like, it's possible here. And Scott, why don't you go ahead first and then I'll say what I was thinking. Go ahead, Scott.
Thank you, Leslie. Yeah, I think it's reasonable to rely on both you and Sylvia to see people's comments and be like, oh, this is in Buck's field. This is in Scott's field. Like, it makes sense, I think, for you both to be able to reach out to the social media experts on this panel to be like, can you clarify this question? Just considering, yeah, we all have different thoughts and opinions, and all of our different workloads. Like, I just think it might be less of a burden to just let you two be kind of the filters in that regard. Because this is, we are providing our input, but this is also going to be both Leslie Ann and Sylvia's final report. So I think that's kind of maybe a middle ground where both you can reach out to the experts, even though they're not the one asking the question.
Yeah. Yeah. Appreciate that, Scott. Thank you. Other thoughts or?
Lynn, Tori says if it'd be good to see a clean copy, but also to see comments. So that might.
That's what I was thinking too.
Yeah.
And so I'm wondering, what I don't want to do is kind of like, I don't want to confuse you guys with like what I'm calling kind of like historic comments that we've already responded to them in the document and everything. You know what I mean? And you'll see that in the track changes version, but I don't see why we can't, like, we could de-identify and put the comments on the hub, right? If people wanted to reflect and look at the comments in their totality, we could keep them all collectively and have them up there. I just want to not create a process that gives you guys too many inputs to try and filter through. I kind of want you to cleanly respond to what you're seeing on the page and give us your thought. I mean, it worked really well for us because I feel like everybody gave a very articulate and pure response to what, from their perspective, they felt about the matter. And you were great too about going on to say, possible solutions for your concerns, or, whatever it was that would help move toward acceptance of this. Because even the opposed comments were not really flat out like, I hate this. For the most part, it was more like, wow, we really need, this is bigger than I thought. We really need to consider this and that, and it's more complex than first thought of. And that's very important too to raise, right? Brian, go ahead.
The only thing that I ran into is it was a little difficult at times to maybe give the input that I was looking to give. So I ended up sending you a marked up PDF as well, because in some sections, as far as saying that the edits, or there's some grammar stuff in there, I ended up putting that into the PDF. So I don't know if that was helpful.
It was super helpful. Yeah.
So once I was able to do that, then it was easier for me to give some of the input. And I'm trying to remember back. I think that there weren't line numbers, and I think we were asked to put. Was that right? Am I thinking right to this?
I don't think so.
It wasn't numbered, no.
Were we asked to give you line numbers about where it was on the page?
No.
Or maybe that was part of the difficulty for me. I was just trying to figure out where to tell you where something was or whatever. So
If it was a very specific word, like the third paragraph and the second, I think we just had you reference page number.
But again, it's tough when you have that many people, because ordinarily you've got like 3 or 4 people reviewing a document, and then you can do track changes, and it's like simple. But with that many people, I think it worked.
I know.
I think it worked as well as it was going to, as far as with the task that we have with this number of people.
Good. So seeing a clean where I'm trying to give another way to see people. Yeah. Okay. Good. And then Kristen, I'm trying. Kristen's saying generally the process was straightforward. The timeline was tough.
Yeah.
Yes. Building in time to carefully review the document, confer with others in my organization, or to confirm our feedback as an entity, analyze, refine, and then submit the form. I would have appreciated more time. Yeah. Well, and let's talk about that today as well with the next round. Okay, Kristen? Yeah.
That sounds great. I'm just sort of thinking ahead about, it's summertime. A lot of people are taking vacations. I know I will personally be taking some time off. And so I think having a really clear understanding of what the asks are and when we need to have things to you would be much appreciated.
Mm-hmm. Mm-hmm. Okay. Well, hopefully we will have time in a little bit later in the meeting to kind of confirm the timeline and everything. And if we want to adjust that, let's definitely talk about that. Because we are on a deadline externally for our work, but we want to recognize all that y'all are doing in addition to this committee's task, and want to have a thoughtful process as much as possible. So. All right. Okay, so I think we have some consensus here that we'll go ahead and do the clean copy for next round, but have comments, available on the hub if anybody wants to refer to those. And then when all the comments come in, we can certainly post those as well on the second half. Okay. And then we'll just encourage each other to not overwhelm ourselves too much. Right.
So for those of you who unfortunately didn't have an opportunity to complete the tool or read the report, we don't know. It's one or the other or both. Read the report, complete the tool, or one or the other. Was there anything in the process other than time probably that created obstacles for you to complete that process? We're just trying to get a sense for what was it out of the total amount of folks we have on the committee. It's probably less than half. So, well, it's close to half responded. So for those folks who didn't respond, was there anything about the process that really created any obstacles for you and your ability to complete the process? Heber, just time. Yeah. Time is, the time for this is just not having enough time. Let's see, let me read some of these. The timing. Okay, Annalise wasn't able to finish. Grant writing time, end of fiscal year. Yes, end of fiscal year, and we certainly understand that. Even for us, the time crunch it's a time crunch just to even get the feedback and try to get it in there and get a finished product back to you guys. So we understand that time is our nemesis here in the process. Mm-hmm. So as we think about moving into this next round of the second half of the report, and to include the child on child abuse, which will be back in the first half of the report, and talk about timing. Let's keep that in mind as we move. It was to have that conversation later today to see, because we really would like to have everybody's input on the report, everybody from the committee as much as possible. I mean, if you don't have any comments, that's fine. But we would like to make sure that we try to get everybody's input and going through the reading of the report and validation process. Any other concerns, questions, thoughts about the draft process, the validation process, anything for anyone?
And can I ask, for those of you that didn't have time to submit your feedback, did you have time to read the report even? Or was it all kind of tangled up together? Yes, I was able to read it for Annalise. That's great. And then, so that gives you some context, right? Even if you didn't comment on it, when you go back and read it,
Nicole too.
for the second time,
Chris
you'll have,
too.
yeah, right. You'll have a little bit, it's not a cold read necessarily, so you can kind of see how it's
Okay.
changed and everything. Yeah.
So for those of you that did not have an opportunity to comment, there will be an opportunity for you to submit your input. We're going to talk about that later on in the presentation today. So you still will have an opportunity to do that. It just will be that plus the second half of the report. So just keep that in mind. In case you do want to comment on any parts of it. So having a clean copy of the report and the comments in the hub might even help folks in being able to provide some comments back.
Mm-hmm. Mm-hmm. All right.
Okay. Well, we appreciate you for taking the time to read it, and to those of you provided input back. Thank you very much.
Right.
As Leanne.
Ready to move on here. Okay. So, as we're thinking about pulling our report together, and, we're now almost at this stage of starting to prepare ourselves for thinking about, none of these recommendations that we're making, very few are like turnkey, right? Like we can just put the recommendation out there, and the next week something can be changed in Oregon. They all have an implementation trajectory on them, a pretty extensive one actually. So we wanted to help kind of prepare the group for that reality, and wanted to just bring in some concepts from implementation science, which is kind of this, the study of how you get from an innovation to that getting on the ground with fidelity and in the way intended, and to hit the kinds of outcomes that you're hoping to accomplish with that new initiative or that change or whatever it is. And so we felt like this was a good time to kind of come together and talk through some of those concepts to really prepare all of you and us for identifying those considerations together. And so we wanted to sort of help us think about how we guide this change process with some of the principles of implementation science, right? So I wanted to just share with you what implementation science is. Raise your little thumbs up symbol if you guys have heard of this before or have used it in other contexts. Yeah. I want to talk a little bit about, great, a bunch of you have, what are the key components of implementation science, right? And dive a little bit deeper into, what are the stages that we need to pay attention to that are so important in successful implementation, and what are the drivers systemically and organizationally around making sure implementation works as intended and really sticks. And then how do we want to apply implementation science to your task, right, of putting any of these changes into practice in Oregon? And then kind of touching on, what are some of the unique challenges of implementation in the human services environment, particularly in the child welfare environment, in the public sector here, that we all know too well, I'm sure. But when we think about what implementation science is, I always think about it as moving from the what to the how, right? Of how are we going to make policy or practice changes really happen effectively, right? And so the important thing to think about is that now we're talking about sort of this meta topic around our recommendations, and our, you always have to have an it for implementation. What's the thing that you're trying to put on the ground? And we're really still in the conceptual stage in some ways in this committee's process, even when we articulate what the recommendations are and our rationale for how we've arrived at them. There's still a lot of considerations for how would that really get put into place? What are the ways that the conditions that need to be in place for that to work well, especially thinking about it as a statewide kind of implementation for all of these recommendations. Those are lots of different environments within which things need to fit together and make sense. And so really implementation science helps us consider what are those critical success factors that are necessary, right, to be able to put that initiative on the ground, whether it's tweaking your scope of jurisdiction, or narrowing that a bit, or whether it's shifting your definitions of child abuse to some degree, or any of the other things that we've talked about, and ensure that it really produces the intended results that you're aiming for, which for us has always been first and foremost safety for children, right? That's our kind of driving outcome here. And then again, it helps you account for multiple complex environments that you might be operating in with these changes, right? The fact that there are uneven resources across the state, right? Not every community has the benefit of the same level of resources throughout Oregon, as in every state is that way, right? And of course, the sense of urgency oftentimes about the need for the improved outcomes that we're aiming for here. And so it really just helps, we're really, as we've said from the very beginning, we're driving toward evidence-based practices to be central to our recommendations. And we want to make sure that those evidence-based practices are as effective as possible by addressing each stage of implementation. And we'll talk about that in just a minute. And so there are several key components of implementation science, right? One is the fact that this reality that implementation, a lot of times you'll hear policymakers, especially legislators, think about implementation as, the turn of a key, if you will. And, you set a date for implementation and therefore it shall be. And really, we all know at the ground level that implementation is a process that really occurs in stages and requires a lot of strategic planning around that to really move through each of those stages effectively. There's also issues of fidelity and adaptation, right? We can create the best recommendation in the world and, a model that we believe is going to be tested by research and evidence and has good track record elsewhere. But there's always a fidelity factor here, right? There's certain key elements of anything that gets put in place that have to be adhered to in order for you to replicate those same successful results, right? And so that's the two parts of implementation, right? Did we put the thing we want to change on the ground as we intended to? Did that happen the way we intended? And the second part is it having the impact that we thought it would, right? And so in that process of putting it on the ground as intended, there's adaptation that has to occur, right? To fit your environment, to fit your constraints, right? To fit those local contexts. And so it's that balance point of, do those changes still, ensure the fidelity of what you're trying to do, and not, influence the kinds of results that you're hoping to make. So that's really the work of implementation, is watching that process, continually making sure that you're monitoring that process. And that's really where those drivers come in. Those are both the investment in the infrastructure that you need to make in order to have the capacity to put whatever it is you want into place, and then making sure that you have those conditions in place in order to put those changes into practice as in terms of what they require. And those kind of fall into three categories of drivers. One is competency, right? Do the people know what they need to know about this change process to put it on the ground effectively? The other bucket is kind of around the organizational environment itself. Is the organizational culture ready for this? Do you have the infrastructure in place to deliver on it, right? And then there's the leadership and oversight of the effort, right? A lot of times this requires really closely and visible leadership in order to elevate this priority change amongst all the other things that everyone's doing to really get the attention and support and commitment that it needs. And then finally, there's the continuous improvement process, right? Again, there's very few things that you can just put out in the world and they immediately take hold and happen the way that we all imagined that they would, right? And this is where using data and really being able to know, how are we going to know if this particular change is in place the way we want it to be? Is it working as intended? What kinds of legitimate adjustments and refinements to it do we want to make? So that's really about having this continuous feedback loop, right? Of who are your implementers? How do you continually hear from them to know what's going on the ground? Analyzing your outcomes periodically as soon as you can collect those accurately, and then making necessary adjustments along the way. And so, with this particular committee's work, we've got this set of recommendations that you all are helping us validate, but we're really at the sort of putting it on the ground plate. We're producing this report for the main audience being the legislature, right? Who are your authorizers of change, if you will, right? And so we're sort of ahead. We're coming in and bringing something in to inform that step in the process. And that report is going to be the content that we're hoping will unlock that authorization for these changes to begin to occur. And then there's a whole nother segment of work that will ensue, which is design the change initiative itself out of these recommendations, right? Like, how, if we do go with this, referring a small set of third-party other, allegations to your other safety partners in the community, that whole process needs to be designed and crafted and put into, you know, a format that can be distributed around all of the different jurisdictions that you operate in Oregon, and make sure that that's happening effectively. Kind of like what you've done with your MDT process here in Oregon, right? You have that framework that you're trying to lead people through for consistency and continuity throughout the state. And so once you have that, then you can apply the implementation stages, right? Of exploration and installation and initial implementation and then full implementation, right? So this exploration is kind of what we're doing right now, right? Really assessing the readiness for change in Oregon and identifying, what these targets of change are that are needed and for whom, right? And that's kind of started to get articulated in our recommendations. But there's also readiness about the environments themselves, right? And that's what I want you all to start to be thinking about as we think through the recommendations in the next, several weeks as we conclude here, because that's what will help us to be ready for installation, which is really starting to put some things on the ground, right? Making sure that you've got that infrastructure in place, that staff are trained appropriately, that you've got the resources in place for the implementation to happen all over, right? And that you might be piloting some of this in certain locations that are representative of the whole state, right? And being able to test these things out on a smaller scale so that you can make adjustments and improve and tweak things before you do full implementation and bring these ideas to scale. So I think the other thing to think about, and this is just some of the specifics of those domains of implementation drivers that I was speaking to earlier, right? Getting folks skilled in what these changes are about, right? Just making sure our whole committee understood what we were talking about, right? You can see what that takes as we're going through our validation process. So you can only imagine the training and coaching and ongoing support for staff and partners and others that might be needed to put some of these ideas into practice. Obviously, documenting all of this in policy and practice and making sure your data systems are there to help sustain this over time. And of course, as things are constantly changing in the public sector all the time, making sure there's consistent guidance and advocacy from leaders to really champion these new interventions, right? So these are all the kinds of domains of the types of implementation considerations that we're thinking will live, right, in all of these areas, right, that we're speaking to in our report. And so when we look at kind of return to our little graphic here of about and thinking about applying some of the principles of implementation science to your task of putting these recommendations into place, we're kind of looking across these and seeing certain recommendations cluster together in our minds and kind of make sense to implement together as a package, if you will. So we're not thinking there'll be separate implementation considerations for every single recommendation, but there'll probably be sets of things that will say these are sort of interdependent on each other, this set of recommendations, and so we need to think about them together and plan for the implementation of them together and think about what that might take. And so, as one example of that Sylvia and I just started to already think about is, this recommendation related to narrowing the scope of jurisdiction slightly, right? By reducing the span of the third party other, right? That really goes together with another 1, 2, 3, 4, 5 recommendations, right? That are kind of dependent on that working well, right? You wouldn't want to do that without having your alternative pathway of some sort, right, in place, right, to be able to potentially have an alternative way to respond to some allegations that are being reported to the hotline. You also would want to be clear about naming perpetrators in statute, right, for this to make sense as well. And lifting some of the requirements that are in place right now for ODHS, for example, to issue all the child abuse dispositions for anything that is assigned, right? That needs a little bit of flexibility for this to work. And certainly allowing the referral of some of these other stranger and other kinds of categories to your law enforcement partners would also be necessary for at a new level for that to happen, as well as being very clear about what abuse really is, right? And so some of the definitions that we've had in the past that stretch the definition of abuse to things that typically aren't considered abuse would kind of fit together with that as well. So so as you're reading the report, right, we really wanted you to be thinking about, what implementation considerations come to mind for you for any topics, but even this kind of groups of topics that you think may be interdependent on each other, right? And again, we're not going to ask, you don't have to put that in the validation form anywhere. We're just asking you to jot down your ideas as you're reading, right? And maybe come to our August meeting then as you've now absorbed the totality of all the recommendations together in this second round of the report, and come with those ideas, right? Things about training or things about building partnerships or agreements with law enforcement or, anything like that that you feel like would be really important implementation considerations to make any of these recommendations be effective, okay? And that way we'll come as well to the August meeting with kind of Sylvia and I's preliminary ideas of what we're envisioning as well for these clusters of recommendations that we've been thinking about already, and get your input on that during the meeting as well. And then we can have a kind of robust conversation to add your ideas to that, to continue to shape that so that when this report is handed in, it not only offers these seeds of change, right, in the recommendation, but it's also kind of laying out what it might look like and the level of effort and what things are more near term, what things are maybe going to take a little bit longer trajectory to get in place, and what are some really long-term changes that you really want to create the commitment and ongoing support for to really follow through all the way to the end on. I'm seeing the chat fly here. And oh yay, Lisa's got charts and things that mirror this. Great.
Yeah, this was a baby pet project of mine. So one of the teams that I manage is our project management office, and we've been talking about implementation science and doing a lot around this for years now. And it's I love it because everything you said aligns with everything that we have been sort of trying to do in terms of technical assistance for our program people. This is actually this little project, and I'm going to email you all a copy of it because there's a couple more pages that explain some of the different steps. But we actually said, wouldn't it be great if we could provide some education sometimes to some of our legislators and lawmakers about the reality of what it takes to implement these things. I totally get it. People think in election cycles and 2-year terms and things like that. And so this idea that they want quick wins. And I say again and again, I would much rather have something that's effective and implemented well than something that's done fast, because that's how we make mistakes. And we also set ourselves up, right? Like we set ourselves up to try to accomplish something that truly is not it's not doable. And so even with this particular project and these two groups, like they gave us funding, but it was like, oh my gosh, how are we going to get contracts in place when you think about what it takes to procure a government contract? And so we had to jump through hoops and get like a emergency procurement approval and things like that. So really wanting people to understand is, yes, the law is passed, but now there might be staff to hire or contractors to hire and onboarding and rules to write and, you know, and the rule process in general of, you know, yes, there's writing them, but then getting them approved. So anyways, I put that little Gantt chart in there, and we've been working on this for a while and really wanting to help people understand how to be more realistic in the asks and how to allow for more time for good quality implementation, because you're going to get a better outcome when you have time to do good quality implementation.
Absolutely. I love that. So yes, I think educating the legislature is really important, because that's kind of your engine of where a lot of this change begins in Oregon. I mean, I think that's true in a lot of states, but that disconnect is really an important gap to try and bridge. Absolutely. Other thoughts or reactions? Okay. Sylvia, is there anything else you wanted to add that I missed, or?
No, nothing that you missed. Just, I think the only thing is really talking about, I don't think he talked about this, just the amount of resistance to change and
Oh,
resource constraints and complexity of needs that come with implementation science, especially in a child welfare system.
absolutely. I
So-
did, you know what? I forgot to turn the page. I actually have some things to say about that. But you're right. I mean, especially in a child welfare environment, right? Where there's constant, you know, it's a very, you know, it's a system that's based on managing risk, right? And so risk always scares people a little bit, and people have different points of view about how to mediate or manage that risk. And so whenever you introduce a change element to that, right, everybody's got to feel safe again, right, by going in that particular direction. So I think that's a particular area of implementation consideration that we should be mindful of, is the communication strategy around this, right? Like, how do you make sure that, you know, people's comfort level is relatively maintained as you move toward improving outcomes for yourselves, right? And that there will be some stretch and change, but how do we, you know, hold on to trust with one another? How do we hold on to expectation setting as you're moving toward those kinds of changes, right? The other thing about resource constraints, right? We're constantly in an environment right now that's challenged by, you know, uncertainty, frankly, right, around the resource picture. And you again are operating in a state that has these pockets of, you know, urban, maybe better resourced areas, and you've got a large segment of rural population. So really thinking about not only what those resource constraints are, but what's the practicality of some of these solutions in those different environments, and how do you shore up the resources accordingly to do that, and what partnerships are needed to do that. It goes back to that thing again of like not being the sole entity being lodged in one agency for this huge societal responsibility of child protection, right? That's a shared, as our values state in our report, that's a shared responsibility throughout the community. And again, the needs of the population that you're serving are constantly changing, right? And becoming, the better you do your job, ironically, the more concentrated the complexity is of those that you do serve, right? And that's important to tool up for as well, right? Which is one of the main reasons why inviting the community in to share in some of these lower risk situations and some preventative kinds of alternative pathways is actually a way for you to hone your skill even more deliberately to address the needs of those families who can't be served by anybody else but you all and your expertise in child welfare services. So, those kinds of, not only readiness challenges and preparation challenges, but strategic challenges and communication and education challenges with those that you work with and rely on to make the system run is something to keep in mind. Not to let it daunt you, right? Because it can be a little overwhelming, but it's something to just plan for and be aware of. So with that in mind, I think that we will also add a couple, we can add the information, Lisa, that you already have around that. If there's resources that people can, tap into to get more information. I know that the National Implementation Research Network, NERN, it's called, is a really great resource that we have referred to in the report quite a bit. That really gives a lot of great practical tools around this work. So with that, I'm going to go ahead and, again, we're a tad early, but I'm thinking now is a good time to take a little bit of a break. I know we have one member who had to step out and is coming back at 2:30. I don't think we'll take quite that long of a break, but how about if we take 15 minutes and come back at 2:20? Okay, and then we'll continue on and kind of orient everybody to the second half of the report and the rest of our agenda. So get yourself some refreshments, take a break and stretch, and we'll come back here at 2:20. Thanks, everyone.
Okay. Looks like most people are back. I think we can get ready to move on. So we're going to spend a little bit of time just reviewing the process for reviewing the second half of the report. And once again, orient you to the validation process for the second half of the report. All right. So validation steps round 2. We want everyone on the committee to read the whole document, right? Because we made changes based on your comments and your input. So we would direct you to reread the first parts, and you're going to have to do some validation of the second half and the child on child abuse. So you have to read the whole report. If you submitted that first half validation form, then you're going to receive an email with the chart of your first half responses. So if you were a person who responded and made comments, you're going to get a email with a chart of your first half responses so that you can kind of track what you responded to and look at those changes based on the comments. And there could be other people's comments as well, but changes were made. So you'll get that. And you'll get some instructions in the email about how to do that, right? How to look at those and see. If you didn't do the first half validation, you're going to have to use the first half validation form if you want to make comments on the content of the first half of the document. So there will be 2 different. If you didn't do the first half of the report the first time, you would have to do 2 separate forms: the first half, or the first part of the report, and the second part would be a different form. Okay. Everybody needs to use the second half validation form to write your second half validation responses. So you'll get this. If you didn't respond, you'll have 2 validation forms to respond to for the first half of the report and for the second half of the report. If you did respond, you'll get an email that has your responses, and you'll be able to compare that to the first half of the report, and you'll get the second half validation form. Remember, we need everybody to read the full report. Now, what we're thinking is right now is that we would have you submit all of your input by Friday, July 18th. We would love to get that sooner if possible, but that's the same amount of time we gave you for the first half of the report. So we just want to see, since some of you said time was an issue, we really wanted to check in with you about the Friday, July 18th date. So you would be getting the report tomorrow, which would be the 10th. You would have till the 18th to provide your responses. And that's doing a comparison of your first responses to the first half, looking at the child on child abuse in the first half, which is included in the validation form. Sorry, Leslie, go ahead.
I just wanted to say one little clarifying thing about this thing about if you did submit your input last time and you get this little chart of your answers, we're only looking if it changes your answer from before, right? So in other words, if you said accept with considerations, or whatever our terminology is, right, before, or even you said oppose before, does it move you up on the scale at all, right? Do you now accept as is with the new changes, right? That's what we want to know. It could also go in the other direction, possibly. You could hate what we wrote. That's the edit, and go, in the other way. But we just want to give you a chance to kind of revalidate, right? Because you read it one way and now you're reading it the revised way, right? So to your point, Kristen, about time, that is going to be it's kind of the same chunk of work for everybody this round, but you guys that already did the first round, you're just thinking about how is this different, and the folks that haven't done anything yet are going to have to give their input on the full report for the first time, right? So back to Sylvia's question, how does July 18th strike you as a due date? Does it make your head explode? Can you live with it? Do you have a negotiating alternative that feels better, that isn't September 12th or something? Let me see. We have
Brian says an additional week would be helpful.
Okay. My 10 days coming up are fairly scheduled. I'll do my best. Yeah. Now that's a fair proposal as an alternative, Brian.
So I'm not a voting member, but I was just thinking about what you said. This is the same amount of time as the first half, and it sounds like there's more work this time. Even if you did already go through, you're going to have to go through it again. So it seems like we should give folks a little more time than we did the last time.
That's a fair assessment. It's not double the work, but it is more work. You're right. Because remember, we front loaded the first half with most of the report, and this is like a third more. Yeah. Let's see, other thoughts here.
The comments are, yeah. Lisa Joy says, what's the most amount of time we will be able to get?
Yeah.
Timeline's too short for Sam. Another week would be helpful. If we're hoping for a better response, another week might be helpful. More time, Judge Lev, more time is better. So the responses are not rushed.
Very true. Or no responses. We'd be really sad if we got no responses. Sylvia and I were noodling on the break, and I think we could manage giving you guys 2 full weeks to get your responses back to us without crunching too badly our edits on the back end. Do you know what I mean? Because that's the thing we're trying to aim for, is that final deadline. Because remember, it's August 30th that we're trying to kind of wrap this up so that it can get some readiness for the submission to the legislature. So that would put us then at 25th of July. How do y'all feel about that? Close of business, even midnight on the 25th would be fine. But again, if you guys don't have a packed calendar next week, anybody that wants to get it in on a flow, but we're open for any time along there. Much better, yay, 100%. Yeah. I'm just gonna wait till the last day before it's due. Adam, you are so honest. I just love that.
All right, 25th it is.
Cool. Sounds good. Okay, we will change that everywhere in here and in the minutes and every place, and get that out. Still get you the product tomorrow. Close of business. Okay, so you'll have the report in your hand at that time.
There's a comment from Brendan regarding anybody else having Google form validation problems. Brian says he did that first.
Does anyone want to share what kind of problems they were having and how they resolved them if they no longer are having them? Brian?
You resolved it. I can't even remember now, but I ended up calling you and talking to you, and you had somebody there that took care of the technical issue that was going on, but I don't remember what the problem was. Sorry.
Okay. No, that's okay. We haven't, the only real Okay, but I can log in and it doesn't link to the report.
You can't log in.
Well, that's because the report's not there yet, Brendan. So you're early.
No, I think, Brenda, do you mean for the first half of the report? Yeah, he couldn't log in and and it wouldn't link to the report.
Did you do that, Brendan, today? Or?
This is,
So I dropped it in the chat. I've had
Uh-huh.
an issue with Google Form before. Sorry, my dog's barking at me. Where you have to adjust the settings for Leslie and Sylvia, you would need to adjust the settings, and it will allow folks to in.
It would allow folks to do what, Adam?
So, like, I've had this when I've had Google Forms for state employees to fill out, and they can't get into it. And then I've gone into the settings to adjust the things that I've put in the chat, and it has then worked for those state employees. So I'm guessing it's some sort of filter.
Yeah, I think we already have that set right now. These 4 things that you're looking at right here. But I'm going to work with Brendan offline and make sure that we can resolve whatever problem he's having. And then somebody else, Tori, said, I have the same, but I sent you the forms directly. See, you shouldn't have to log in. There's no logging in to the Google form at all. So that may be part of the issue. You do put your email address in at the beginning only because it helps us distinguish one respondent from the other. That's the only identifier we have. But it's not a login that's required.
I think with mine it was there was like some permission request or something. And so,
yeah.
like I
Okay.
would do that, but then it won't let me in the document, and then I'm like sitting there. I don't know how that permission request works. I'm assuming you have to give me permission, but if you're not on your computer at the same time, then is that tomorrow I get it? Or I mean, I don't.
Yeah. Okay. Well, this is something, just think of us as a help desk. Okay. So if you guys have any problems when we send you this link tomorrow, getting in, just get right back to us. I'm actually going to put our team member, Martha Hurwitz, as the contact point for this, because she's going to be the most adept at helping everybody solve their problems around this. I have this much knowledge, but she has a lot. So how's that sound, Sylvia, if we do that in the email? Okay. Then you'll have if any problems, contact Martha and she'll help you. And Brendan, we can follow up too, just so I know the nature of your issue and get you in touch with her as well. So yeah, don't ever hesitate, you guys, to reach out and say, help, I'm having issues, because I want to use your time wisely as well. Okay.
Right.
All right.
Okay.
All right. So then moving right along.
Right along. So let's talk about what you're going to be reviewing.
Yes.
So in the first half, we covered background, methodology, findings, recommendations, prevention, early intervention, and initial safety response, and then also shared responsibility for investigations and the definitions. So what you're going to be focused on this time is the second half of the report, which is the investigations due processes pieces. So investigation, addressing standard of proof, enhancing client rights notification, strengthening implementation of MDT best practices, and extending SDM model to CPS and Otis investigations. Due process will be streamlining the appeal process, establishing a child abuse registry, and adopting an expungement criteria. And the other thing you will need to do is address the child on child abuse section. It is in the first half of the report. So you have to look at that first half of the report to see that section. So those are the two areas. This is actually a smaller section. The first half was really the bulk of the information. So this is a condensed section that you'll have to do. So we'll change that date on there. It says July 10th to the 18th. We'll change that to the 25th. You'll have till the 25th to respond. But if you can respond sooner, that's great. We'll be watching, monitoring, and taking feedback and looking at and making, adjustments as needed as we go through. The following sections really that are still in light letters there below the big red box will be circulated. They'll be written and circulated for your review before the August 13th meeting. So before we meet on August 13th, we'll send you the implementation considerations that we've come up with, and if there's any you submit to us, our conclusion and the appendix where we are keeping all of the information from the validation forms. So that will all be included for your review and would be distributed to you before our next meeting, which is scheduled for August 13th. Any questions? Additional information you want to tell them, Leslie Ann? Anything I missed?
The only thing I was thinking about is, okay, so we moved the time for input out, which is great. So between the 28th to the 12th is our time to finalize the report, right? Incorporate everything you guys are suggesting around this second half. Go back and do anything else on the first half, write these final sections, or at least draft them out, because August 13th is our last meeting. We want to send you that full final report before that meeting. Now, with the old plan, we thought, a couple days, like on that Monday or something before the 13th or whatever, but it might be just like hot off the press in your hands right before we sit down at the meeting on the 13th. So we're going to do our best, right? But kind of maybe that's another little bit of a crunch on everyone's calendars is you're going to get this final report and we're going to be sitting down in a meeting kind of the next day and asking ourselves these reflective questions like, did we get the implementation considerations, the highlights, right in there? Is there anything missing? Is there anything we want to be sure and add to this report at that point? Questions? Are we doing an in-person for August? We are not. We voted to do a virtual for that last meeting. So thank you for that question, Diane. I do think we'll probably use all 3 hours though, because you guys might want to spend the first half an hour reading the report. I don't know, we'll have, in order to have our discussion in a meaningful way. So we'll figure that out, but anything else, Sylvia, on this slide?
No.
Okay.
So here's our timeline. You see for June, we've completed the first half of the report and you guys have reviewed it and responded to the validation form by June 19th. We incorporated that information. Now you'll be receiving the second half of the report tomorrow, and we'll change that date to the 25th. You will have till the 25th to respond and submit the validation form no later than the 25th, but sooner if you can. So anytime between tomorrow when you receive the report and the 25th, we'll take the input. It would be great to get it. The sooner we can get it, the better, because we need to start making whatever edits we need to make. for August. So let me just reiterate, when you're reading through the report, we really want you to think about implementation considerations. So you're going to be reading through the whole report, see how that information it comes together, and just jot down anything that comes to mind around implementation considerations that we should include. As Leslie Ann said, we will be coming up with those ourselves as well, but we really want the group to think about that as well. And we will discuss that on August 13th as well. So we can get any that you guys have for that at that moment. We will have the final report for your review on August 13th, and our final input on the report will be due by the 21st. So we may have some conversation on the 13th that leads us to add more information, or we may have additional information we want to include, especially around the implementation considerations. So we want all final input by August 21st because the report will be due on August 30th. So that is our timeline. That's the timeline we're working with, which is why we know it feels crunched to review it, but we really do need to get your input as soon as we can. Any questions, concerns about that? All right. Leslie Ann, anything in the chat we know?
I think we covered everything in there.
Okay, great.
Going to be sure and include Cassidy in our communications. She's taking Iris's place. Okay, good. All right. So we wanted to just walk folks through one more time, and especially for those of you that haven't had a chance to do it yet, just what this validation activity looks like for you, right? And I know we keep saying second half of the report, but this document that you're going to get tomorrow is the full report up through that second half, right? Obviously, we're not literally giving you two halves of a report in two separate documents. We're giving you the cumulative content, right, up through that second half. Okay, so that's what you need for this activity. You need that second version of the report, and you need your associated validation form or forms, depending on whether you've gone through the first round or not, right? All of that material, we'll send you a link to it within this email that I was just talking about. And it will be housed on our communications hub, right, for our committee. So that's where those materials will live. And again, this will go to the 25th. So let me bring up a different thing for a moment here and just show you. Can you all still see my screen? And it has now changed to something called Jurisdiction Advisory Committee validation form here, right? So I'm going to show you the second half input form first, okay? Because we're kind of just continuing the story here, and then I'll go back and I'll show you guys the first half as well. So this is the Google form, right? That you'll get a link to. If you have any problems with that, you just, contact us immediately. We'll troubleshoot for you. But you'll land on this page. It's got a little introduction telling you what we're doing. There's a link right on here to the draft report version 2. That will take you right to our hub right here when you click on that, right? We now have a report page on our hub that has our findings and recommendation report information. And at the top here is the report will be here tomorrow. This includes the revisions to the first half, right? And then this is the input form itself, right? So this is where you can download this report right from here, right? And if you scroll down here, this is where the first half validation tool is, right? Okay, So let's go back here though and just, I do really, you're not going to start here, right? You're going to, the report itself, just download it. That's your first task, is to read it, right? And then you come to this validation form when you're ready to give your opinion about things, right? And so it reminds you what's included here in this form that you're giving validation for. It's the child on child abuse section, right? Which is on page 25 of the report. And it'll then skip to starting with a whole new set of recommendations for investigations and due process, but it starts on page 33 of the report, okay? So you're going to be doing that one skip around in the report with respect to what's in here. We'll change this due date here as well. You go ahead and enter your email here. I'm going to go ahead and do it just so I can show you how this works then. So then you hit the next button and it'll immediately take you to the child on child abuse section here. You can give your input, right? Let's say you read through that. You love it. You want to accept as is. If that's the case, when you hit the next button, it will take you automatically to the next topic, okay, which is addressing standard of proof, right? So let's say on this one, right, your opinion is, you agree, but with some conditions, right? And if you answer that option, then you'll get another window or another sub question here, which will ask you an additional question. Please give specific details about the conditions or changes you feel are needed to accept this recommendation, okay? This little asterisk means this is a required field. Okay, so you can't say accept with conditions without telling us what the conditions are, right? So you can say something like, add more rationale for how we arrived at this, at this recommendation, whatever. You can go to town, right? You can tell us all kinds of things in here that you think might be wrong with it or need to be adjusted by it, okay? And once you're done with that, it'll take you to the next one. And I'm just going to show you all the options so you see how they all work. This is about enhancing client rights notification. For some unknown reason, perhaps you oppose this. Okay, I'm just going to pretend here that you are not at all in agreement with this particular recommendation. And if that's the case, then you go on to a next set of questions where you answer two questions, right? Please describe why you oppose this recommendation, right? And please give us an alternative recommendation that would be acceptable to you, right? Whether that's even do nothing, keep the status quo, or suggest an alternate solution or whatever. It's really helpful if you are specific here, right? You can see it forces you to answer these, right? Before you can go on. So, put something in here, put something in here. And then you can go on to the next question. Okay, you can also go back, right? If you change your mind and all of that. And once you get to the end, you hit submit, right? As you're answering that last question in due process, and that'll all then be fed back to us and go on to our response spreadsheet, okay? So it works exactly like it did before, right? For those of you that haven't been through this before, that's how the first half one will work as well. Questions? Would anyone who hasn't gone through this before like to see the first half validation form too and see how that's different than this one? Let me just go there real quickly. So here's the validation form on the first half input. This is going to be for folks who did not submit anything at all the first round, right? When we did this before, okay? This is, we'll change the date on that as well. It works exactly the same way, right? Where you put your email address in, you go ahead and you can respond to even the background section and the methodology section and, you know, the other narrative sections in the report, right? Anything that you found, typos, errors, weird wording, anything you want to give us about that. Same with the methodology section. And then it goes right into the findings and recommendations. And it starts with prevention, early intervention, bring alternative pathways to scale. Okay. And again, you've got your 3 options to choose from here, and it works exactly the same way. Okay. So if you answer accept as is, it automatically takes you to the next recommendation in order within the document as it appears. If you accept with conditions, you just have to say what those conditions are, and then you move on to the next item. Or if you oppose, you have to answer the 2 questions, and then you go on to the next item. Okay. So this is a little bit longer of a form because we have 12 recommendations in that first half that were delineated. So this is something where you'll answer all plus the background and methodology sections as well. Okay. And so this should allow you to capture everything. You know, if for some reason, like Brian did, you know, you have some other piece of feedback you want to give to us that isn't particularly tied to any individual recommendation or any section of the report, you can do a couple things. You can either send us an email and just tell us what, you know, like the language is too sophisticated, make it, you know, less easier to understand, or, you know, whatever. You can do it that way, or, you know, like Brian did, you can make a PDF of the file itself and just put comments in it, you know, wherever you want to. But all of that is more work than you need to. I think this should capture everything substantive that you need to say and just use the validation form, okay, as much as you can. Questions, comments, concerns, ideas?
Can you do us a favor and attach the second draft to the email like you did before with the first? That's super helpful.
Of course, yes, yes. We will do that when we send out the instructions tomorrow. We'll attach the report right there.
Perfect, thank you.
A PDF of that, yes. Yeah, because that saves you the step of downloading and blah, blah, blah. And then you can just start reading, right? And get that much done, you know? And then just interact online when you're ready to do your reactions. And now that you kind of know how the form works and know what your options for answers are, you know, you can like make some notes to yourself or comments to yourself on that document in the margins or using your comment feature, whatever, and then bring that with you. And when you sit down to do this, and it'll make it go super fast, right? You could just copy and paste those comments right into the fields here if you wanted to, if that's an easier way for you to go through it. Okay. Any little time saver, you know, or ready to share tips and tricks around that. Other thoughts or questions? Okay, if I go back to the slides here, if there's no other, anything anybody wants to see on the forms. Oh, I forgot that little animation. We already did take a look. Okay, that was supposed to be my cue to go pull up the validation form, but I jumped the gun. All right. So let's just recap, shall we? Next steps here, right? So we are going to do our final little dotting the I's and crossing of the T's through tomorrow and get this new version of the report out to you tomorrow by the close of business, along with the links to the validation form. The report itself will be attached to the email. The other thing that those of you, the 13 folks that did their first round already and gave their feedback to the first half already, you'll also get an individual email with your little chart of what your validation input was, and just keep that by your side, and you can use that to tell us about any changes that you have in terms of the first half after you read the revised version. Okay. We are looking for everybody to get us all of their input by July 25th, which is 2 weeks from this Friday. Okay. And we will then, on a flow basis, begin to accumulate and respond to and absorb all of that feedback that y'all are giving us, and make any changes, low-hanging fruit we can before all of it comes in, and then make all of the improvements and adjustments, and we'll be writing those remaining sections as well. The conclusion, the executive summary, the appendix, all of that, so that you guys can have all that for our August 13th meeting, where we'd like to present you with that final report draft in advance, right? At least 24 hours in advance would be my hope. And then at the meeting, we'll discuss and give input on the implementation considerations for the full report, celebrate our accomplishments. We'll be doing that virtually. That'll be August 13th from 1 to 4 p.m. And that'll be our final meeting of this stellar group that we've had the pleasure of working with for almost a year. I can't believe it. Anyway, so thoughts, reactions, anything you want to clarify or ask about before we wrap up today? Everybody feeling like somewhat of a doable task for us to wrap up our work together and have that final chance to come together next month?
Mhm.
Diane says yes. Thank you, Diane. And so does Amber. Yay. It's been so nice having you guys, and I know you came in a little bit later in the process, but your voices to this effort have been so critical and wonderful. So thank you. Yes, finish line in sight, Scott. Feels like we've been on a marathon together, doesn't it? Oh yeah, no problem, Nicole. We knew this might be a push. We were just thrilled that we got like half of you guys to get this done the first time around. So now that we have this little bit broader window, I think you'll be in good shape. And again, I really encourage anybody, if you have questions or problems or any technical difficulties or anything, don't hesitate to reach out, okay? All right, Sylvia, any last words of encouragement?
No, just when you think about what this all encompasses, just think about all the work that you've done, and this is your opportunity to just read through, see what information is in there, give your feedback, and really have your voice heard. So I think that's what's important, is we really want to hear from you and be able to incorporate your information into this report as well, because that's why you were part of this process, and we want to honor that.
Mm-hmm.
I just want to again thank everybody. I know I was kind of in the beginning here, and then I passed the baton to Sarah, and I've been able to hop in a few times, but I just want to send like my absolute appreciation to both Leslie Ann and Sylvia, one for taking this charge on. I don't think they even had an idea of what all they were getting into when we said, hey, we could use some help. And to all of you, I mean, the commitment, like getting on today and seeing, I think at one point there were 26 participants. I know that a couple of us are the facilitator, but I mean, that is so impressive. And the commitment you all have made to this, and the fact that you all have been able to come to some, you know, common understanding despite all of the differences. Like, I cannot say enough how appreciative I am. I'm going to try to make it on the 13th. I'm sure Sarah will be here too, but just again to express my deep appreciation for all of you in the time and everything you've put into this. Thank you.
Well, we couldn't have been more thrilled with, you know, the opportunity, and you guys have worked so hard to help us pull this all together. So just appreciate it. Now we got the final push to the last finish line. We can do it. All right. Okay, everybody. I think we'll make it a wrap at 3 o'clock and give you guys an hour back. Okay.
Thank you.
Yes. All
Thank
right.
you.
You guys have a great evening, and we will be talking to you in between and see you next month. Okay. Take care. Okay. Or is it down to, let me just figure out why. I can't seem to find my Fathom